Welcome back to the PFC podcast. The views and opinions you are about to hear are the speakers and do not necessarily reflect those of anyone else. Now on to the podcast.
Welcome back to the PFC podcast. This is Dennis, and today I'm with Berger Langda. Thank you very much for coming on. How are you doing?
It's really good to see you finally chat with you. We've been waiting for a few months for this. Yeah.
Yes, absolutely. So since it's the first time on our podcast, would you mind doing just a real quick introduction of yourself?
Yeah, sure. So basically, I've done the bachelor's and master's in maxillofacial surgery for dentistry, and essentially traveled and taught in various parts of the world. And basically now what I like doing is teaching people how to handle dental emergencies in an austere environment. Having been in many austere environments before around the world, just sharing my experience in this particular field of management with medics in general.
Perfect. So you're definitely the guy I need to talk to, because I'm preparing to go down range, and I'm with a team of meat eaters that generally don't listen to me until something has gone too far. So what kind of gear, what kind of prep do I need to do before we go out the door?
So there's two pathways of preparation. One is the preventive preparation of the participants who you are taking on the expedition or trip. So just to make sure, like 3 months before your trip, you try to motivate them aggressively to go and have a dental checkup done. Secondly, why 3 months is because that gives enough time for the dentist to deal with any dental problems he or she might find. Next is a preventive aspect for the participants. Like, preventive aspects should be strongly motivated. Put them mainly on a high fluoride toothpaste so that covers them for the duration of the trip. Explain to them the importance of at least brushing twice a day, spitting and not rinsing, keeping the toothpaste on the teeth. Explain to them that however tired they are, it's so important to floss their teeth every day and maintain their good oral hygiene, not only for their teeth, but essentially even for their gums. Check out if they have a medical history, if they're asthmatic. Remind them that it's so important to rinse your mouth after using the inhaler spray, just because in high altitude or in hot environments, you have increase in duration or chance of getting oral thrush, increase in chances of getting stress ulcers. So prevention is the key. The next thing is to prepare yourself. Take an adequate kit. With respect, you're thinking of, when you're taking a kit, you're thinking of the duration of your expedition, the type of expedition you're going on. For example, is it a mountain biking trip? Is it a high altitude trip? You're also looking at your budget and your weight considerations. You cannot take a whole dental clinic with you. And finally, the skill sets which you have. There's no point taking an entire extraction set with you if you don't know how to extract teeth. If you don't point taking local anesthesia with you if you don't know how to give local anesthesia. So I think the basic kit which everyone should take is a pre-mixed temporary filling material, which is sedative to the teeth, which cools the teeth down, something like Cavit, and also a material which is used very good for acting as an intra-oral bandage. For example, if you're mountain biking and if you fall down and crack your front tooth, then you need another material called glass ionomer, which sticks chemically to the teeth and covers the tooth up and protects it. The rest of the kit is sort of like, is a common kit, which is a mixed kit with your normal medical kits, because you'll have cotton in your normal medical kits, you'll have antibiotics in your normal medical kit. And again, you have to compromise. You can't take everything. So the antibiotics we generally recommend them taking is something like Augmentin, which is amoxicillin with clavulanic acid, which sort of covers the dental bugs as well as is useful for general medical use.
Okay, perfect. What kind of procedures or common complaints should I expect when I'm downrange? Like, it can't all be just impacted wisdom teeth or things like that. Like, what are the common kind of injuries that I should study up on or ask questions about?
So when you're going on a trip, what sort of common things which you will face is common things occur commonly. So essentially, the one of the most common things is broken fillings. So you should be prepared to clean the tooth and replace the filling with a cool sedative dressing. That's one. Secondly, you could have infection below or adjacent to the filling. So therefore, you will need something like antibiotics to cover that bit of it. Thirdly, you may be going with a young, fit population. There may be smokers in it. And these people are generally predisposed to what you correctly said, impacted wisdom teeth, which tend to flare up at the back, which is known as pericoronitis, or inflammation of the gums around the teeth, for which you may be useful to take something like a local oral antiseptic. And because a mouthwash is hard to take, the easy one to take is Corsadil gel, which is the same mouthwash, but it's like a chlorhexidine gel, and it's easier to carry. And I always recommend anyone to go on a long-term trip to go on a high fluoride toothpaste, which has 5,000 parts per million of fluoride, which is like you're off at 5,000 or something in that category, which is really good to have.
Okay. Now you mentioned cavities. I don't have a drill. Are there hand tools that I need to use, or can I just use like a Dremel?
That is such a good question. So basically, if there is a hole, like for example, if you imagine a filling, and a filling has come out, patient doesn't realize that the filling has come out maybe for a couple of days. So now that area is full of soft, cheesy stuff. Now, why has the filling come out? It could have simply come out, or there could have been decay below the filling, which has caused it to come out. But you still have to clean it at least a little bit before you fill it. What consistency of stuff you're planning to clean? It is like soft, cheesy stuff which you're planning to clean. So we generally recommend everyone to take a medium-sized dental excavator, which is a little spoon-like instrument, which is used to scoop out the dental muck from inside the tooth before you can put the filling on. Now, how do you use it? We always recommend them to clean the tooth from the center outwards rather than from outside towards the tooth. So that prevents or decreases the chance of you pushing the spoony instrument into the dental nerve. Now, what if you don't have that? If you don't have a dental excavator? Essentially, use your lateral thinking and say, you got muck inside the tooth. I need to clean that muck out. What can I use? You can use a simple dental floss by going in and getting rid of the muck from between the teeth. You can break a little matchstick and use the end of the matchstick, which is like a soft wooden piece, to clean the muck from inside the tooth. You can tell the patient to rinse his mouth with salt water really well to clean the rest of the debris out of the tooth, and then you can pack the tooth up with something like Cavitt.
Okay, very good. So that's the common things, broken teeth, cavities falling out, things like that. I think I feel a little more confident. Okay, now you just learn how to scrape out the junk and essentially apply a new filling or a new cap of some kind to protect the remainder of the tooth until we can get out of there. But some of the things are definitely emergencies. Okay, and when I've gone downrange in the past, some of the areas that I've gone to, they do not apply the same amount of effort towards dental care as we would in the States or in Europe. So you look in their mouth and it is a horrible, disgusting thing.
So true.
So they're coming to us with infections, with pain. Like how do I know that this is an emergency or not? And two, like how do you even approach something that like this is going to be so much work?
So true. I mean, you obviously have got practical experience because you pointed out some very, very, very realistic facts. So when you go into an area, firstly, as you said, the patient could have a lot of dental problems, number one. Number two, you're there for a limited period of time. Number three, there's a long line of patients waiting. You can't do all the treatment on that patient. So then how do you decide what to do to keep that particular patient happy, as well as to keep the rest of the crowd happy and to complete your dental procedures for the duration of that trip there, or the posting on that particular area there? So basically, first ask the patient, and when the patient comes, the sheer fact that the patient has walked for probably miles to reach you shows that the patient is desperately in need of your help. Secondly, ask the patient, where does it hurt? Now, the patient will point to all the four quadrants of his or her mouth. So narrow that down and say, where does it hurt the most? They will narrow it down a bit. And then I frankly tell them that I can do only one side of your face at a time. I can't do the right side and the left side. I can probably do one side and probably do as much as I can. I can't do everything. So point out, which one do you want me to treat? So they point out to the tooth. Then I look at the tooth and see what is the condition of the tooth and what is the condition of the gums around the tooth. So the tooth is badly decayed and there is a swelling, inflammation, pus discharge, or redness around that area, then I know I have to deal with that particular problem first. So I explain to them, that is the one I'm going to deal with. Then it depends upon the time factor. If I have time, then I will do more. If I have less time, I will do less. Because remember, I don't have x-rays. I don't know how long this extraction is going to take. Nextly, when we go, we always take Articaine, because Articaine is 4%, Lignocaine is 2%. So Articaine acts faster, saves you time. It's a deeper acting anesthesia, so therefore it can work in the presence of inflammation and pus much better than Lignocaine. And thirdly, I am generous with my local anesthesia. So I give a block for most patients. I give an infiltration for most patients. Why? If I have to re-give the anesthesia again, I'm spending more time with that patient. So might as well go in first, give enough, treat the patient quickly, and first shot, try to get it in the first shot, as much numbness as possible. Also, whenever we go, we know that you can deal with these patients much faster if you got a good help. So whenever I go, the first thing I do is get on the good side of the translators. It is a team approach. You cannot deal in humanitarian dentistry or osteomedicine dentistry or medicine single-handedly. You must involve everyone. So I just make sure that they know it's a team approach. I train them on how to hold the head, because I cannot hold the head and do the extraction. So they know the local language. They know how to hold the head. They are on my side. We have a good banter going between them. It's a good, friendly approach. And that again helps in cutting the time down and establishing a good procedure. Also, before doing the extraction, I try to give them a painkiller, like something like ibuprofen, so they got to walk 3 hours back again. Next, also check and make sure that they've had something to eat. Otherwise, we just give them sugar water just to pump their sugar levels up a little bit. You got to remember that they generally will have malnourishment, have had a long distance to walk there and a long distance to walk back after an extraction.
Mm-hmm. Absolutely. So, I mean, that was definitely a good point about making sure that they have food. Because once you numb the crap out of their mouth, they're not going to be able to eat, right? Now, do you send them away with, more ibuprofen or whatever locally that they normally would be able to find?
Yeah, we send them, all of them take ibuprofen. So basically, they take one after a couple of hours, one that night and one next day in the morning. Simply because we don't have limitless supply of all these medicines. We have only an X amount. So we have to make sure they're distributed well, but there is insufficient for everyone. There won't be a perfect amount, but there's sufficient. for everyone, and there's enough for a backup in case we need it. That same applies to antibiotics also. And
Okay.
they're the same, like even if you're rather than in a humanitarian field, if you are in a wilderness medical field, and everyone says that, yes, do I need to give antibiotics for a fractured front tooth? I would say possibility is you may need to, but see if you can get away without giving it, simply because you don't have a limitless supply of it. There may be somebody else who needs it more. So, for example, if someone's fallen and broken his front tooth, you would see how it goes. But if there's inflammation, swelling, pus discharge, then of course you would hit that person with antibiotics. But if the tooth is broken, there's already an established drainage, there's no blockage of the dead or infected material, the patient may be able to go to 2 or 3 days without needing antibiotics. And basically you saved up that antibiotics. Because when you go for all these trips, there's such a lot of weight and space restrictions that you don't carry that much stuff with you.
Yeah, that definitely makes a lot of sense. Now, do you go over some kind of disposition of like, hey, go back home, recover for X number of days, and then come back and I'll do the other side? Or do you not make those kind of promises?
We don't make those promises. So it depends upon the numbers. So we generally tell them we will do one side, but if we are going like in Nepal, we were going at the same area for 2 or 3 days in different locations. So yes, then they could come back the next day. And also we are less patient. So yes, I did it there, and they did come back, quite a few, to have the other extractions done. But in some other deployments, we only go to one location and then go to another location the next day. So that doesn't work.
Right.
Sorry.
That's all right. No, I think it's also very smart. Do not make any promises to anybody, because if you break that promise, because it could be you're a liar, it could be that you just can't do it. Don't make any promises, because you're going to ruin the rapport for the next guy that comes, or if you happen to come back,
So true. So no concrete promises. We say always we say we will try to extract the tooth. We will try to do the filling. We will do our best. It may work, it may not work, but we will do our best. If the tooth breaks, it breaks. Then maybe it will be pain-free and the bit of the tooth will work itself out, or the body will eat it up. But if it gets infected, if you have any problems, you will unfortunately have to drive probably 5-6 hours to the nearest hospital and sort it out. It is what it is. We will try our best, but that's all we can do.
Yep, absolutely. So, you mentioned using arcane versus lidocaine. Have you ever come to a situation where just your regional blocks or your local blocks infiltration was not enough, is augmenting with a systemic agent like ketamine or fentanyl or morphine, is that ever a thing with austere dentistry?
Yeah, Dennis, you got to remember, I am so happy with regional nerve blocks. That is my field. And I will go and give another regional nerve block, another type of local infiltration. Whereas you guys, on the other hand, are so happy with ketamine and the others, that is your natural domain. So if I wanted to have anything additional on those lines done, I would probably go to the team members like yourself and ask them for their help, because that is not my strong point. My strong point is regional, and that is what I'm comfortable in. And you guys are so good with other methods of pain management. So as I said, it's a team approach. So every time we have to deal with anything outside the normal or which stretches our comfort zone, we just come together and find a solution. And that is the charm of taking individuals from different aspects of medicine and experience to come together to work. It is a team at the end of the day.
Yeah, absolutely. what other kind of emergencies? So, when somebody's walking up, you have no idea where this is going to go until they open up their mouth. They may have tooth pain, but they open their mouth and it's a massive infection. At what point are you saying, like, this is an emergency, we're not going to handle this, or it's probably unwise for us to handle this on our own? We need to get this person to a hospital or some higher care.
Basically, the very few like that, besides trauma, so we're leaving trauma out of it. We're just talking of the dental aspect of it. And I think the only dental emergency is large-scale abscesses in a medically compromised individuals, and there are lots of those in those areas, who have difficulty in opening their mouth, and you have difficulty in access, especially if they're children in a refugee camp. And that is where, they need high dose, rapidly of IV antibiotics and evacuation into a hospital setting. Even in those patients, if they were adults, medically compromised, if I could somehow get inside their mouth and take out that offending tooth, it could help in decreasing the pressure of the abscess area. But it's the children, because they can go downhill so rapidly, that we have to be super cautious with. So it's very rare. Come across 2 incidences in my entire career in austere medicine dentistry where I have had to say that this one has to go fast out. And such patients, you cannot do an intubation because there is a chances of a parapharyngeal abscess. They are very difficult people to intubate. So you need highly specialized attention. And if you can't even get access and pain management, it's a whole big scenario. So it's really hard to do. And the other one is like people who are local in the area. Like, for example, it could possibly be your porters in a long-term like a trekking trip, who are malnourished, possibly, who are chronic smokers, who are possibly dehydrated, and they get this really necrotizing infection of the gums inside their mouth, and it looks horrible, and they're in acute pain, but they don't need Medivac. What they do need is high degree antibiotics and treating them holistically. So you have to make sure that they try to stop their smoking, check their nourishment, check their fluid intake, give them local antiseptics and systemic antibiotics and deal with them. So those are the 2 big ones aside from trauma, not talking about trauma here.
Okay. Yeah. When you're teaching courses or you're teaching local populations about oral care, like what are the big topics that you hit when it comes to educating the populace?
Essentially, it would be divided between diet and hygiene. So diet, unfortunately, what we're realizing is on our last multiple trips is that water, they don't trust the water. There's very little water in that area. Even when there's lots of water, for example, when they live next to the river, Coke and cold drinks seem to be cheaper than water. So they drift in that direction because for them, it's a safer alternative than water. It's cheaper than bottled water. So we try to tell them how harmful it is, not because of the quantity. It is the frequency which is the worst bit. It is not how much of those acidic, sugary drinks they drink. It is how often they drink it, which is the most important. And even individuals going on like endurance athletic trips, that is what we try to tell or stress to them. It is not how much, it's the frequency of your acid exposure, which is the main thing. And of course, secondly, it's just oral hygiene maintenance. Now, quite a few of in that region have this thing in their head that they want to rinse their mouth vigorously after brushing their teeth. And what we try to communicate to them is like toothpaste is like a medicine. It needs to stay on your teeth to act. So if you wash it away, you don't give it enough chance to act. So you've got to like leave it on your teeth to act. And the comparison I give is that if you have a backache and you put some cream to relieve your back, you don't go for a shower or a bath after that. So therefore, the same thing is with the toothpaste. You need to keep the toothpaste on your teeth. It is a medicine at the end of the day.
Okay. No, very good. Do you ever try to educate whatever their local provider is on dental care and how to kind of further on the things that you were doing there?
Oh, yeah, definitely. So especially because with the Team 5 Medical Foundation, which we go with, we are divided in various pathways. So the one pathway is that we teach the local medical or dental providers. We have a training course for them. We run clinics as well as we teach each other to improve our skill sets. So when we go, the first day is spent in going over regional nerve blocks with the local providers, which will be a local dental therapist. There's improving the local anesthesia techniques, checking over the extraction techniques, how good they are. And usually they are very, very good. But then, because we need to share our skills together, so they show us their tips about extracting the teeth, and we join together and learn from each other. But then I also teach them different techniques of intra-oral suturing, which they love because they haven't come across that. Finally, we teach them a bit about jaw wiring, how to put a bridle wire, how to wire the jaw together and stabilize the jaw, which they may or may not do, but they're very interested in learning temporary splinting, like how to do a barrel bandage. That is what they really want to learn, because that is what they can do quite easily and transport the patient across. We also go through how to handle jaw dislocations with them, and they're refreshing the technique of jaw dislocations. I teach them the easier techniques of jaw dislocation, how to use a syringe as a rotating fulcrum in reducing the jaw dislocation. So we have a training course which lasts for nearly 5 or 6 hours for them every day. And then they join us in the clinic. So they run one station themselves next to me. I run one station next to them. And then one of our colleagues from the rest of the team joins us to refresh the dental skills, because it's humanly impossible for me alone to do 46 to 50 extractions in half a day and then more later on. So you do need a hand. So that is why we train our team members into giving local anesthesia, extracting loose teeth, because at the end of the day, we have to work together to get through to the day. And that is what glues the whole team together.
Yeah, absolutely. Now, if you had any advice for me when I'm getting ready to deploy, other than what we've just talked about, what kind of advice would you give to me?
So basically, I would tell you to tell your participants, whoever's coming on the trip, to be proactive in the preventive dental care. Make sure they go for a dental checkup. Make sure they have an oral hygiene. And when you go on the trip, re-motivate them. Remind them again. In your kit, I would definitely suggest like a pre-mixed sedative filling material like Cavit. But also what many people don't take is a powder and liquid mixture filling material called glass ionomer, which is an excellent intraoral bandage. So that, for example, is somebody's climbing, slips, falls, and chips his front tooth. You need something to cover that front tooth, to reduce the sensitivity, to prevent the ingress of infection, to reduce the sharpness. And that is an excellent intraoral bandage. It sticks like glue to the teeth. And that is what many people don't carry. I also would advise you to take a few, maybe 3 or 4 nasal clips of a face mask, because they're incredibly good to use as a dental splint. For example, if somebody fractures their tooth or knocks their front tooth out and you replace the front tooth back in, you can just put the nasal clip of a face mask across as a dental splint and then glue it together with your powder and liquid filling material mixture, which is your glass ionomer.
Okay.
Those are the two things I would definitely carry. Another thing is possibly take a tube of Austere gel, which is chlorhexidine gel, which is a good intra-oral antiseptic, easier to carry than a mouthwash. But there is only that much what you can carry or prepare, because you might not have any dental problems in the whole trip, and bless you if you do that. But you need to carry a little bit, but be sensible with the weight restriction, with the budget restrictions. For example, if you're going on a long-term, like if you're going to stay on an island, like an Antarctic trip, for a long-term trip, we also recommend our individuals to carry leather mix paste. Now, what that is your get-out clause. So in case you have a deep broken filling, this little tube is a mild antiseptic steroid cream, and you drop it into the depths of the hole and cover it with a temporary filling material, and it is excellent at cooling an angry tooth down. Now, it is expensive, so not many people carry it. So I say if you don't have it, and if you reach such a situation, then you can just take a small ball of cotton, make it moist in clove oil, just moist, not dripping, just moist, pop it inside a deep angry tooth, and gently cover it with Cavit or Colteam, which is your pre-mixed temporary filling material. And what that does is, oil of cloves is an astringent. It deposits proteins on the ends of the nerves there, and also helps in reducing the pain down to a certain extent.
Perfect. So I also know you run your own website as far as Austere Dentistry. Would you mind telling me about it?
Yeah, it's essentially the Wilderness Expedition Dentistry website. So what we've done is we've loaded all our videos, all our teaching materials on that website, just to spread the knowledge of how to handle dental emergencies and basic facial injuries, primary management of facial injuries, how to deal with that and how to get out of that situation if you cannot reach a dentist in that period of time. The best thing is, of course, to reach a dentist or a doctor in that period of time. But if you cannot reach a base hospital, what can you do? So all the teaching material is available totally for free. And also all our slides are available for free, which is downloadable. And yeah, essentially, we just don't want people to have a toothache or suffer when they can avoid it, if possible.
Yes. How do I find it?
If you just Google Wilderness Expedition Dentistry, or it is www.wildernessdentistry.com.
Perfect. Hey, thank you, Dr. Langdon.
Thank you, Dennis. It's been great talking to you. Sorry it got delayed so much, but it's lovely talking to you.
That's it for today's podcast. Make sure to go to our website, www.prolongedfieldcare.org. Check out our free downloads and a ton of other helpful information. Grab a bag of our fresh roasted PFC coffee, links in the description below, and stay on the bleeding edge of combat and austere medicine. This is Dennis for the PFC podcast. Out.